I also echo my thanks to a great panel, a rich discussion. And I told Carlos at lunch when he was talking about how we should think about incorporating social media into our own individual selves as our brand and into our organizations. I said, so who does those makeovers? I need to sign up for one of those makeovers. So anyway, we've got a rich afternoon, as you've already seen with our panel discussion. And so our next one, it's panel 3, is identifying audiences and crafting messages, for example, behavioral and social science. So I'd like to call up our moderator, Marthe Gohl, who is the Logan Professor, Department of Community Health and Social Medicine, the Sophie Davis School of Biomedical Education, City University of New York. And we are going to use digital technology, assume here of Skype, to bring in other panelists of Sarah Gullis, Assistant Professor, McKnight Land Grant Professor, School of Public Health, Division of Health Policy and Management at the University of Minnesota, as well as Jeff Niederdeppe, also via Skype, who is the Associate Professor, Department of Communication, College of Agriculture and Life Sciences at Cornell University. So I will turn this over to Marthe. Thank you.
Thanks, Senny. I just saw Jeff up on the screen, but I don't think everybody out there has a chance to see him. Ah, great. So I'm very pleased to be moderating this session on crafting messages, which is bringing insights from the social and behavioral sciences. We've heard so far today about methods to assess media and create stories that pique interest, and when we're actually lucky, action at the level of both members of the public and by their decision makers. Listening to the speakers this morning, I was struck by how much the communication counsel we heard has parallels with the counsel provided by wise public health practitioners and their organizations. Experts in both communication and public health extrapolate from experience and rely on their best judgments and those of their colleagues in trying to achieve their ends, communication in one sphere, improved health outcomes in the other. Both sectors often must act without a pristine evidence base of effectiveness about what works. In part, that's because there's little funding has historically been directed towards studying either population-based multisectorial health interventions or communication. But equally important, because capturing causality in big communication campaigns shares similar difficulties with charting causality in population efforts. There's always a lot of noise, and it's often hard to know what's going on and where to attribute effectiveness. We've heard repeatedly about the power of stories, qualitative information, combined with data, quantitative information, in communicating messages that are resonant with the public, in some cases, and decision makers in others. What we will hear in this next presentation from Jeff and from Sarah, some provocative information about the evidence base, about the effect of different ways of framing stories and information about health inequalities and or social and environmental determinants of health. What is the right dose of narrative? What is the right dose of fact? What is the frame? As Bob Hornick said this morning, quit or work to quit gives you very different answers. What influences people's opinions and responses? Do political characteristics of participants influence how their reactions to the messages that are being communicated? So as Sani said, we are going to do this by Skype. I gather from Jeff and Sarah that they're going to alternate in the presentation, and Colin is going to be the wizard that makes this all work. I think they're going to disappear from our view for the moment. We're going to hear their voices while we look at the slides, and then when there's time for the discussions, they will come back and join us. So off you go, Jeff, I think.